My involvement in MonaLisa Touch started 7 years ago when I was contacted by a friend of mine who is a professor in dermatology. He's a great expert in laser, great user of different lasers, and he approached me because he treated at that time many different conditions such as scars, acne or atrophic conditions in dermatology. And he asked me in a way to explore the possibility to use a CO2 laser even in gynecology. We therefore thought that vaginal atrophy, that was a very bothersome, and it's actually a very bothersome condition with a great impact in quality of life, could be the ideal condition where CO2 laser could be effective. And therefore I decided to start with an ex vivo study, and I had the approval to treat the vaginal wall of women that I submitted for prolapse repair. And during the procedure I decided to treat one part of the vagina that I usually trim because it's an excessive tissue, and then I use the contralateral part as control. Actually, we've got at the moment at least 10 trials running in parallel in my unit. After the ex vivo study, we were allowed to run 2 different pilot studies on women with VVA. One was a pilot study looking at the effect of CO2 laser in treating vulvovaginal atrophy symptoms such as vaginal dryness, dyspareunia, burning or dysuria, and at the same time looking at efficacy. We were allowed to recruit only women who had tried everything else for their condition. They were recruited from our outpatient menopause clinic, and where women were in a ward we didn't have any other chance of treatment. We therefore recruited this group of women where we offered, quite arbitrarily at that time, 3 treatments with a distance of 30-40 days in between. And we managed to demonstrate that VVA symptoms significantly improved treatment after treatment. We then looked at the changes that fractional CO2 laser could have on sexual function. We know that in postmenopausal women, vaginal dryness may bring to a very impaired sexual function, and therefore we recruited 77 women who were all wished to have a normal sexual life, but because of VVA they had some problems. When we compare the results at the end of the 3 treatments, we managed to observe a very significant improvement compared to baseline, compared to recruitment state. What I think is probably one of the best clinical results is that on entry, 72%, despite being symptomatic, had a normal sexual life. At the end of the treatment, 96% were sexually active. So we managed to get back to a normal life, almost 20 to 24% of women. Moreover, we also managed to demonstrate histologically significant changes. We were allowed to take 5 biopsies at baseline and after one single treatment in 5 consecutive women, and we observed a completely remodeling process in the vaginal tissue with a restoration of what we could say was the vaginal wall in fertile age of these women, restoring the lamina propria, restoring and improving the thickness of the epithelium, but most of all also reproducing lubrication in the vagina. The way MonaLisa Touch produces a remodeling of the tissue, it's a part, in my opinion, of what we can call regenerative medicine. Fractional CO2 laser produces a remodeling of the tissue in 2 different ways, with a microablative effect and with a thermal effect. Microablation is a sort of revolution in CO2 laser. One of the major worries of people using laser was the excess in heating up the tissue, in determining some tissue damages, but with a fractional CO2 laser, the possibility to deliver in dots, in columns, the light, make possible to create a bioactive activation of the tissue without creating any damage. The great effect of MonaLisa Touch has been shown in many different histological samples, and this is something that should be very much emphasized, because despite the fact that at the moment we haven't got placebo-controlled trials, so in a way we cannot control yet which is the placebo effect, but there are no single data, no single paper showing that placebo can ever determine a change in histology. The procedure is performed in an outpatient setting with the patient lying in a supine position, in gynecological position. The vaginal probe, the vaginal handpiece, is introduced gently down to the end of the vaginal canal, to the cervix if the woman has the uterus, or to the vaginal vault, and then it is retracted accordingly to markers that are designed on the handpiece itself. We've got two different types of vaginal handpieces. One is a 360-degree probe and one is a 90-degree probe. In other words, there is a mirror reflecting the laser beam that could be in a pyramid shape that delivers the laser circumferentially almost, and a 90 degrees that delivers and reflects the laser beam just 90 degrees backwards. Therefore, with a 360 degrees, you might need just to turn once of 30-40 degrees at each single marker level. And with a 90-degree probe, you should basically make a sort of hexagon before retracting the probe itself. MonaLisa Touch is a very straightforward procedure. The only women where we don't do the procedure are women with an active or suspected vaginal infection or urinary tract infections. The other condition where we prefer not to do that is in a woman who's got a history of herpes virus, where we do that only under prophylaxis. But apart from this, there are no real contraindications, and the procedure is very well tolerated. We actually produced a paper in women with history of breast cancer, treated for breast cancer. We presented that at the AAGL meeting in Las Vegas last year, where the procedure was very well tolerated despite the severity of the condition itself. We offered in these women up to 5 treatments, and the efficacy rate was quite good. We have different protocols for MonaLisa Touch. In postmenopausal women complaining of VVA symptoms, we offer an average of 3 treatments with a distance of a month in between, with an efficacy rate of 86%. In women who've got a previous history of breast cancer, or if they had radiotherapy for cervical cancer, we offer between 5 and 7 treatment, depending on the severity of the condition at baseline. And it's very much dependent on how they tolerate the increasing of the parameters of the settings that we use for their treatment. Another important finding that we observed, Stavros Athanasiou from Athens published a paper looking at women in postmenopausal age with VVA symptoms and assessing urinary dysfunctions with 3 different tools, UDI-6, ICIQ short form, and a King's Health questionnaire. He observed a very significant improvement in all urinary tract dysfunction investigated before the treatment compared to the end of the cycle. Usually, after the first treatment, you may observe an improvement that ranges between 30 and 50%. Consequent treatments can then further improve their condition up to almost a resolution of the symptoms themselves. The important factor is to be able to increase the setting, to increase the depth of the laser effect that usually happens at the third treatment. When we started proposing MonaLisa Touch to patients, I expected a sort of resistance because it was a new treatment with not very much data available. But I was quite impressed by the fact that, particularly after the first treatment, women returned requesting the treatment even before that we indicated. The importance of having some initial effect after a couple of weeks since even the first treatment was something that motivated very much these women. Moreover, we started with the women who had tried everything else. They were symptomatic, but they had no other choice of being treated. And therefore, there was a sort of by-mouth advertisement. We started with 3 patients per week. Nowadays, we've got 40 patients per week with a huge waiting list in hospital. We have never recorded any major or moderate complications in our experience. We only recorded 5 to 7% of mild bleeding after the first procedure in very atrophic women, as well as we recorded some burning sensation, particularly at the fourchette, at the external genitalia, where the genitalia are more sensitive. This was only after the first treatment. But once you be careful in terms of not including women with infection, as we mentioned, with a previous history of herpes, without having had any prophylaxis, or women who may have a very atrophic condition with a too high setting, then you don't have to worry about any complication. The funny thing of MonaLisa Touch is that the more you use it, the more you understand the mechanism of action. And it's also funny to observe that sometimes women come back to you reporting improvement in symptoms that you had never thought about or you didn't mention to the patient. At the moment, we've got 10 trials in my unit on the use of fractional CO2 laser or other lasers produced by the same manufacturer with completely different indications. I cannot mention very much at the moment, but it's certainly related to the urinary genital tract in women.